Good afternoon. I'm Laurie Halverson. I'm the state representative from Eagan, Minnesota, District 51B. Very happy to be joined here today by a number of health leaders and education leaders in the House DFL caucus, and also to be joined by our majority leader, Representative Ryan Winkler. We're here today because of the e-cigarette epidemic. Now, back in 2014, I was at a conference about addiction and was shocked to hear a neurosurgeon talking about the impact of nicotine on the developing brain. And I was just starting to be aware of these newfangled devices called e-cigarettes. And from that conference in Colorado, I called home. I called a number of people actually in this room and said, hey, what are we doing about this? And the collective answer was, we don't know, we gotta find out more information. And so we set about finding out more information and decided to introduce the first regulations on e-cigarettes in the state of Minnesota, including trying to include e-cigarettes in our Clean Indoor Air Act. The response was lukewarm, to say the least. A lot of people were like, we should wait and see. Maybe these things aren't so harmful. And so we couldn't even pass including e-cigarettes with our Clean Indoor Air Act until 2019. And this year, when that bill came to the floor, it passed with 100 votes. It was bipartisan, and it was met with a lot of enthusiasm, because now we know what we're facing when it comes to the e-cigarette epidemic. So we have watched as tobacco companies, e-cigarette companies, like Juul, target populations in Minnesota, target communities of color, target our kids, all to market an addictive new way of becoming addicted to nicotine and through vaping. What's interesting is those of us who have been around tobacco for a while, we saw what they were doing. They were using the same old tried and true tricks to hook kids in particular on e-cigarettes. Cartoon characters, which dated way back in the marketing of tobacco products, showed up in these new e-cigarette devices in the specter of things like a Hello Kitty vape pen. They used health claims, and we've heard these ad nauseum. These are going to help people quit. Make no mistake, these are not quit smoking devices. In fact, the e-cigarette companies took a stand to say we do not want to be regulated as a quit smoking device, because you'd have to prove efficacy, you'd have to prove safety. They chose to do neither and instead sued the FDA so that they would not have to be regulated. And yet they continue to make these bogus health claims. And also, we watch them as flavors were their primary source of getting folks hooked on their products, kids in particular. And because of their uncanny ability to get these addictive products into the hands of kids, we are seeing an epidemic among the youth in Minnesota. E-cigarettes among 8th graders increased over the past 3 years by 95%. With 11th graders, it was a 50% increase that we saw. Their numbers were already much higher. And across the country, 5 million youth are currently addicted to nicotine through e-cigarettes. Because of these flavors and because of these e-cigarette high-tech marketing that they did with their products, they've addicted our kids. So I've got unicorn drops up here with a cute little cartoon character and a strategically positioned rainbow. That is a product that is supposed to be for adults. It looks an awful lot like something you'd see on your breakfast table even. The Juul pods, which look an awful lot like a USB port, certainly have the high-tech look to them. And kids who talk about vaping, when they talk about Juuls, it's its own verb. They Juul. They don't vape. They Juul. And so the power of this product in the hands of our youth is unbelievable. In addition, we've seen products like this is the Sorin, another very high-tech vaping device. I think a lot of parents wouldn't know what this was if they found it in your kid's room, but this is delivering addictive nicotine to people. And last but not least, we've got the high-tech hoodie. Where this is actually a vaping device, and kids can use this right in the classroom to vape nicotine. So there's no stopping the ways that they are trying to trick us into getting these things into the hands of our kids. So we stand here today as the House DFL caucus, together with our leadership, and to announce a comprehensive agenda to stop the epidemic of youth vaping in Minnesota. We're not waiting anymore. There's no wait and see to see if these things are dangerous. We know they're dangerous. People across the country in Minnesota are dying using these products. There's no more wait and see with regard to the addictive nature of these products. One Juul cartridge will contain as much nicotine as an entire pack of cigarettes, dressed up in a tasty, minty flavor that is going to attract a user, not detract a user. We are going to use proven public policy interventions in order to deter youth from starting to smoke and help kids who are vaping stop. And so together, we're here to announce a group of packages that build on some of the leadership from last session, starting with Tobacco 21, which was sponsored in the House by Representative Edelson and passed the House. We're awaiting additional action in the Senate, and Senator Carla Nelson has shared that she is continuing to work on that this legislative session. We're also going to work to create an Office of Youth Prevention and Protection. Back when Minnesota sued the tobacco companies in the 1990s, our state was really smart in putting together a comprehensive package of public and private funding to make sure that we would be able to use, fight the marketing that we're seeing from big tobacco, and also use these dollars to help people quit. Because guess whose fault it is if you're addicted to a product? It's not the user's fault. Let's make sure that they have the resources that they need to be able to quit, and more importantly, to make sure that we don't stop. Minnesota's tobacco use rates among youth fell dramatically and consistently for 20 straight years until the e-cigarette phenomenon came into our communities. In 2017, we saw the first uptick in youth tobacco use, overall youth tobacco use, that we saw in almost 20 years. And so we need this office. We need to put state resources toward preventing youth use. We need to educate young Minnesotans about the risks of vaping and tobacco use. Representative Edelson is working with a group of students and working with her Senate counterparts to introduce an education package for our schools. We are going to prohibit the sale of flavored cigarettes and vaping, including menthol. Menthol is the easiest way to start smoking and one of the hardest ways to quit. And so we are not making an exception for menthol tobacco use or mint-flavored Juul products. These will be included in the vaping ban, vaping flavor ban that I'm going to be introducing. We're going to prohibit online sales of tobacco products and vaping products. And we are also going to expand cessation resources to Minnesotans. Finally, we know that tobacco prices continue to be the best way to prevent youth from ever starting to smoke. And so we are going to take a comprehensive look at where our tobacco tax policies currently are and look and make sure that Minnesota continues to be at the leading edge of tobacco tax policy, and close some significant loopholes like taxing the vaping devices that somehow made it through our taxation policy system by being a non-taxed item. So we want to be sure that the vaping devices that are being used in addition to the vaping juice continue to have a high tax rate in Minnesota. And with that, there's a number of people here that are going to provide some fantastic background about the vaping epidemic and our need for action. And I would like to introduce Dr. Elise Mann, who is a state representative from Apple Valley and one of 2 physicians in the House of Representatives.
Thank you, Representative Halverson. I'm from actually Lakeville-Burnsville area, 56B. So unfortunately, what we are seeing occur is that the progress that we've made in the falling rates of cigarette smoking rates is being undone by this e-cig and vaping crisis. And it is a crisis, as we know that about 1 in 5 Minnesota teenagers have tried e-cigs or vaping, and these are the same kids who have never tried any other tobacco products. We also know that 3 people have died in the state of Minnesota in the last 2 months because of lung injury due to vaping and e-cig use. And we also have over 80 hospitalizations, with almost another 40 being investigated. Hospitalizations caused, again, by e-cigs and vaping, causing lung injury. Over 1,600 hospitalizations nationwide, with almost half of those needing ICU admission, so intensive care unit admissions. These are not cold symptoms that we are talking about here. And this is completely unacceptable to me as a physician. We have an industry that is targeting our children with things like bubble gum flavored vaping cartridges and sweatshirts with vaping mechanisms right in the hoodies. They are using this as the new entry point to get an entire new generation addicted to their products that we know cause harm, cause illness, and cause death. So I can continue seeing people in the emergency department with acute respiratory distress and respiratory failure, or we can prevent these things from happening and also hold Big Tobacco accountable for misleading the public and targeting our children. And those are our goals here today. Next up, you will hear from an amazing legislator, Representative Edelson.
She says that because we're friends. I want to thank you all for being here. This is such an important topic. I've spent this entire summer not working with youth from my community and from the surrounding community. I represent Edina, Minnesota, at the Minnesota Capitol. What I did with this working group is we tried to identify work within schools to help tackle the vaping epidemic. What we have noticed now, I sent out a survey from my office, and this has changed from earlier today. I sent out a notice from my office asking health teachers in Minnesota, middle school and high school, to do a survey and tell me if they thought the vaping epidemic was an issue in their school. So far, it is Monday, and we're like almost 2 o'clock. I have over 150 responses from health teachers saying they want help on this issue. And that is just, they left probably Friday at 2, and that's when we sent it out. So we will have a lot more updates on this issue. We know that the students identified this. We know that there's only 3 mandated areas of healthcare curriculum that we have to teach, and they were all public health crises. So STDs, AIDS and HIV, and also the CPR was taught in our schools because we realized we need our schools to help. The vaping epidemic is one of them. I'm proud to be the chief author of the Vaping Awareness and Prevention Act, which again was student-led. We passed Tobacco 21 in the House. It died in conference committee. I hope with everything that has happened over the last year, that it will actually pass this year, because I do think it will save lives. I'm happy to introduce Representative Moran, Chair Moran, who is an amazing advocate, and so honored to have you here.
And of course, she only said that because we're friends. Good afternoon, everyone. Again, my name is Rena Moran. I represent District 65A in St. Paul. And this is an issue that is very near and dear to me, as this crisis that we're seeing now, I saw this and was a product of it as an African-American youth myself, with big tobacco targeting the African-American community. So it is no coincidence that tobacco companies have increased efforts to market flavored products, just as they did with menthol cigarettes in the African-American community. These flavors, paired with the rapid rise of e-cigarettes, largely appeal to our youth, providing big tobacco as a new audience to become prime for addiction. For years, big tobacco has used menthol and other flavors to hook communities of color into their offerings. When big tobacco sees people of color, they see dollar signs. Their advertising lands right in front of potential targets in magazines and at the point of sale at places like the local convenience stores. These efforts are coordinated and systemic. While these corporations earn massive profits, people, young people, all people, suffer from chronic conditions and they die. E-cigarettes have provided big tobacco yet another opportunity to addict an entirely new generation. The harmful effects of smoking on communities of color has long been a public health crisis. There are significant disparities when it comes to the health effects of smoking, and study shows that people of color have more difficulties quitting. It's no difference between the impact that big tobacco had on menthols for our community as they are having today on so many other people trying to break the habit from e-cigarettes. The strategy of using flavors to addict African Americans has well been documented, and more needs to be done to counteract it. While we've seen some municipalities step up to ban these flavors, to truly be effective, this prohibition should be extended statewide. Today, we're committed to protecting the health of all Minnesotans, including children and people of color. Traditionally, we talked about the health effects of smoking. It's been in regards to long-term chronic conditions like cancer and heart disease. Now, with the vaping, we are seeing users experience this harm suddenly and in multiple instances right here in the state of Minnesota with tragic consequences. We all are responsible to responding, to reacting to this new crisis. It's not enough for us to simply admire the problem of youth smoking, vaping, and other tobacco use. All of us, again, must commit to enacting bold solutions which stops the pipeline of tobacco and other nicotine products to our young people, and especially, including people of color. Stopping the sales of flavored tobacco and e-cigarette products will provide a barrier to big tobacco's work in expanding the audience to whom they can sell their deadly product. Thank you. And I would like to take the time to introduce Mr. Hansen, who will give you an educator perspective. Thank you.
Hello, my name is Robert Hansen. I'm a teacher at Henry Sibley High School. I'm also the director and coordinator of a group called ALMAS, Anglos Latinos Motivados a Superarse, which loosely translates to Anglos Latinos Motivated to Succeed. We are a group that focuses on eliminating and changing the negative Latino narrative regarding graduation rates, regarding caring for our community, regarding health concerns. I'd like to say that we believe in a healthy community, and we also believe that a healthy community will create healthy students. As I stated, I'm a teacher, and I'm here representing just not my school and not just the teachers in my school district, but teachers across the state, staff members across the nation who are at the front lines combating nicotine addiction in our schools. Imagine, if you will, being in a 45-minute class period, trying to be engaged, but can only think about the next fix of nicotine. A health crisis is occurring, but I, as a teacher, believe that an academic crisis will be on the forefront. These kids need help, and we are winning the battle in many different areas as a group in our school, in our community, but we need help from the legislature and the public in this battle. And so I would like to introduce a few of my leaders from my group, Azucena Esparza, Srey Villafuerte, and Yasael Santiago Castillo.
Hi, my name is Azu Esparza. I'm a senior at Henry Sibley High School and vice president of ALMAS. I strongly support raising the tobacco sales age to 21. Vape pens or e-cigs are a big problem in my high school. The bathrooms have become vape rooms where students go to vape. I also see my classmates vaping outside and at parties and at concerts. We have been told that smoking is bad for us, but e-cigs are perceived differently. People think it's a cool thing to vape. They come in many shapes, sizes, and colors, and they're easy to conceal, and teachers and parents often mistake them for flash drives and other devices commonly found in our backpacks. These products mostly also don't leave an odor, so you can find them anywhere without anyone knowing. Some students even have clothes meant for vaping, as mentioned before, such as the hoodie, where the e-cig is disguised in the drawstrings of the hoodie. I try to stay away from it, but it's everywhere. As a high school student, I know lots of 18-year-olds and through sports and clubs, but not any 21-year-olds. Most of my peers who use tobacco products are using flavors like mint, grape, mango, and bubblegum. These flavors are a strategy to hook us. We can't let big tobacco succeed in making my generation their replacement tobacco users. Smoking and vaping take a toll in our futures long before serious health problems start showing up. Once students are hooked, it's likely to distract them from class, sports, and a job. Thank you for your leadership, and I hope you will support these efforts.
Excuse me, can you pronounce your name again and then spell it for us, please?
Yeah, Azucena, Azucena, Esparza, Esparza.
Hello, my name is Trevia Fuerte. I am a member of Almas. I would like to talk to you about some of the things the Almas group has been able to accomplish. So last year, we had helped pass Tobacco 21 in both Mendota Heights and Dillardale, and as of just recently, we've been able to pass it in West St. Paul. I'm a 10th grader at Henry Sibley High School, and I've seen firsthand what vaping has caused in the school. You can see it on social media too. People will be posting on their stories of them doing cool tricks or asking people to hang out to come vape. We also DJ events at the school, the Almas program does, and at our homecoming this year, we happened to have fog machines, and we would see kids blowing their vape into the fog machines as we let out the smoke. Yes. So I would like to thank you for supporting T21, and hopefully it will pass.
Can you spell your name as well?
Yes, Trey, Trae, Villafuerte, Villafuerte.
Actually, can you show us how that hoodie works?
Yeah, certainly. So,
You can go up by the microphone right there.
Yeah.
And how commonly do you see this in school?
so personally, I have seen these in schools and in class, and a lot of students use it so they can vape through the drawstrings, and the smoke can be easily dispersed. So it can be, say, students will put their hood up and then put their head down and just vape into their actual sweaters and whatnot. And it's really just not a good thing.
Where's the cartridge go?
So, I've never actually used one of these, or like, yeah. So I don't know. I just believe that it goes probably
It goes
through
inside
here.
the hole of the string there. There's actually an opening. And the newer ones are like little flash drives, so they can fit just right inside of that.
And these are commercially available? I mean, you can buy these
Yeah.
from, how much?
I again don't know. I'd assume anywhere ranging from 20 to 40, as it is a sweatshirt, and the only real change is changing the drawstring into a place where you could actually smoke and vape through.
Have you personally seen kids vaping in classrooms?
Yes.
How often do you see that?
Well, usually, since I usually sit in the front as I want to take notes and whatnot, so everyone that sits in the back, mainly, they just put their heads down, vape and whatnot. I can always, if I ever go back to do homework or to get a worksheet, I can smell it. I can actually see if I turn around, students are actually vaping in schools and in classrooms pretty often.
Can we get your name again and spelling?
Yeah, it's Yasael, Yasiel, Santiago Castillo, Santiago Castillo.
What year are you in school?
I'm a senior.
And pronounce your name for us again.
Yasael.
Thank you so much. Well, thanks again to the students of Almas. I think that, as you've indicated, this is a pretty compelling story when we hear about the impacts on our students. So we are open to questions from all of you about this package.
I just wanted to clarify that you're talking about T21, but you're also talking about banning flavored products. Is that a ban for all ages, so adults would not be able to purchase these flavored products?
That is correct. The flavor ban would not have an age limit, age restriction to it, and so it would be all flavored products.
When you're talking about banning online sales, that would be not just flavored products, that would be every vaping product online?
Yes, that's actually one of, online sales is one of the loopholes that we hear that youth are able to exploit pretty easily. Somehow they are really savvy with technology compared with some of their parents. And so it's, even though we have heard from tobacco manufacturers that they have safeguards on their websites, those things aren't working. And it's a very common way for youth to be able to get a hold of these addictive products.
Any Senate support for the flavor ban? Well, Nelson said she's in favor of the flavor ban, I guess, on vape products. But there was one other issue in here. Oh, well, how about menthol, tobacco, cigarette ban?
Yeah, we'll definitely be reaching out and making sure that whatever gets proposed in the Senate, we'll be advocating to make sure it is comprehensive and it includes menthol. Menthol's just been a loophole that, as Representative Moran has said, the tobacco companies have driven through this for generations and really have used it to target communities, in particular the African American community, the LGBTQ community, and now our youth. And so we're going to just close that loophole down. And we're not alone. I mean, there are communities throughout the state who have already taken this step of banning flavors, including menthol. And so once again, our local governments are leading on this. And I think that statewide action, it's time for statewide action.
You mentioned taxes, go ahead.
Along with what my colleague was saying about the flavored ban not being in the Senate, initial Senate language, what kind of recommendations do you have for them at this point?
Well, it does sound like Representative Nelson has an understanding of the impacts that flavors have and wants to introduce a flavor ban, and it hasn't been introduced yet. It's still prior to session, so our language hasn't been introduced to the House yet, but it will be on day one. And so the effort will be to work with the Senate to make sure that what gets introduced is as comprehensive as possible and that it includes menthol. Without that, it really loses a lot of its power.
Are you concerned that, given that they have come out of the starting gate without a flavor ban, that maybe things might settle where you just have tobacco 21 without the flavor ban?
I'm not concerned yet because we haven't, I'll be concerned in February if we don't have a bill introduction. But I think that the work is happening now. I think the sense of urgency is very different than it was when we all walked out of here in May at the end of the legislative session because we have seen what Mayo Clinic has studied and described as chemical burns, from these vaping products. And we are seeing a public health epidemic of injury in addition to addiction that I think has kicked this up a notch in terms of what our response is. And the other thing is all of us are doing meetings in our communities right now. We're traveling around the state, and when people talk to us about what's on their mind with regard to public policy, what are you doing about the vaping epidemic is on everybody's mind. And so we know the senators are hearing that in addition to us as House members. So I think that there's a lot of room and time for us to work to make sure that we have a House and Senate strategy that are very comprehensive. This is going to be one of the strongest strategies in the country, and so we wanted to be sure that we put it out there early, and that we got this great team together to do this work in communities ahead of time to make sure that we had a package that was going to be comprehensive, going to be science-based, and really going to make a difference, as we've seen from other tobacco policies that have passed in Minnesota over the years.
So just so we're clear, the flavor ban, would it be part of the same bill, or would it ride along as part of the same package of bills?
Currently, we're looking at it as a package of bills, and it remains to be seen as we build this, what it looks like, but it will be part of a number of package of comprehensive tobacco bills.
How heavily are you being lobbied by the vaping industry?
Well, go ahead and take a look at the Campaign Finance Board reports and take a look at the way that they have lobbied up in the last year. In fact, over the summer, Juul added 5 new lobbyists registered in the state of Minnesota. So they're working really hard to keep their turf if you will, in Minnesota. Now, they're also doing a lot of messaging around how good they're being with regard to supporting T21 and other policies. That's great. But here, the facts are that these guys have been found through studies to have targeted our kids through marketing. They are the #1 product in our middle schools and high schools. And so it's going to take a lot more than just some nice words to make a difference in youth vaping. And it's going to take us taking away their market in our kids.
And you're looking at some tax increases as well. Can you outline that?
Yeah, well, any time that we talk about tobacco cessation and tobacco policies, price of tobacco is always part of that conversation because it is still the #1 proven way to keep kids from starting to smoke or vape. Minnesota was very fortunate to be one of the first states to tax vape juice, just like at our other tobacco products rate in Minnesota, but we missed the ball when it came to the vaping devices, and those things are kind of being given away, sold very, very cheaply, and so we can give people the device to fill with their addictive product at a very cheap rate, and we don't want those to be as easily accessible. The other thing.
Is there a number in mind that you would tax that at?
We would tax it at the same rate that we do other tobacco products in state law, so. Yep. The nice thing about Minnesota state law is we did this a long time ago. We put the structure into place, and so we are able to fold in new products without too much rigmarole and new definitions because they fall under other tobacco products.
Is the internet sales ban you're proposing, is that for just under 21 or is that for everybody?
That would be for everybody.
For everybody, so there would be no internet sales at all of vaping products or tobacco products?
No.
At all?
No.
And do you envision that to be difficult to enforcement? Have other states done that successfully?
I think that the difficulty will be, when it comes to trying to pass it. This has been a real sales boon to a lot of companies, but what we know is that it's been the kids who have been able to exploit that and get tobacco products through the internet. And so it'll be a heavy lift to get that done and to help people understand what the urgency is around this. So, but it'll definitely be a challenge. And we're working with the agencies right now to talk about enforcement and what those mechanisms will look like, so.
Complete tobacco sale on all products to all people in the
Yes.
state of Minnesota.
Representative Moran, I'm wondering if you have constituents, including small business owners, who say, these are adults and they prefer menthol cigarettes to regular cigarettes. Why shouldn't they be able to enjoy a legal product, and/or why shouldn't I be able to sell a legal product for people who want to buy them? People, adults.
Yeah. So I think the most conversation I hear from businesses and convenience stores and gas stations, because we also have a ban on menthol cigarettes in St. Paul, is that it's a business and the impact it may have on their businesses. I don't think their concern, I have not heard their concern be around the individual and the fact that they are adults. It's more of the impact that they see. But what we do know, especially in the African-American community and communities in color, is that the health impact of smoking definitely outweigh the impact of saying we wanted to make it readily available for small businesses, because the tobacco company has really been a predator in our community for years. And if we're going to look at having better health outcomes, prevent the deaths of African-American mothers and fathers and children, we have to put some perimeters around what we know is killing people.
Time for maybe one more question?
How much support is there for an internet ban on all tobacco product sales and vaping product sales in the Senate that you're hearing about?
Well, as I said, this is kind of our first effort to roll out something comprehensive, so we'll work with the Senate and find out where there is support. What I will tell you is there are definitely leaders in the Senate who understand the gravity of this situation, and then we've heard from Senator Nelson and Senator Dietzich, Senator Hayden, and so these conversations are continuing to happen with senators, and we're going to work as hard as we can to make sure that what's introduced in both bodies is as comprehensive as possible, because we don't have the time to see what happens next with big tobacco in Minnesota.
Thanks, everyone.
Thank you all.